Welcome to RadicalWellnessTV.com. This is Laura Lee. I'm here to explain to you about natural healing ways to be able to take care of yourself proactively so you have a healthy, happy, joyful, awesome life, at least health-wise. Anyway, panic disorder is what I'm talking about today, and I'm going to read to you from a NAMI flyer and find out what locally your locals are doing about this situation. Panic disorder. It started 10 years ago. I was sitting in a seminar in a hotel and this thing came out of the clear blue. I felt like I was dying. For me, a panic attack is almost a violent experience. I feel like I'm going insane. It makes me feel like I'm losing control in a very extreme way. My heart pounds really hard. Things seem unreal. And there's this very strong feeling of impending doom. In between attacks, there is this dread and anxiety that it's going to happen again. It can be debilitating, trying to escape those feelings of panic. People with panic disorder have feelings of terror that strike suddenly and repeatedly with no warning. They can't predict when an attack will occur, and many will develop intense anxiety between episodes, worrying when and where the next one will strike. In between times, there is a persistent, lingering worry that another attack could come any minute. When a panic attack strikes, most likely your heart pounds and you may feel very sweaty, weak, faint, or dizzy. Your hands may tingle or feel numb, and you might feel flushed or chilled. You may have a chest pain or smothering sensations, a sense of unreality, or fear of impending doom or loss of control. You may genuinely believe you're having a heart attack or a stroke, losing your mind, or on the verge of death. Attacks can occur at any time, even during non-dream sleep. While most attacks average a couple of minutes, occasionally they can go on for up to 10 minutes. In rare cases, they may last an hour or more. Panic disorder strikes at least 1.6% of the population, and is twice as common in women as in men. It can appear at any age, in children, or in the elderly, but most often it begins in young adults. Not everyone who experiences panic attacks will develop panic disorder. For example, many people have one attack but never have another one. For those who do have a panic disorder, though, it's important to seek treatment. Untreated disorder can become very disabling. Panic disorder is often accompanied by other conditions such as depression or alcoholism, and may spawn phobias, which can develop in places or situations where panic attacks have occurred. For example, if a panic attack strikes while you're riding in an elevator, you may develop a fear of elevators and perhaps start avoiding them. Some people's lives become greatly restricted. They avoid normal, everyday activities such as leaving the house, or they may be able to confront a feared situation only if accompanied by a spouse or other trusted person. Basically, they avoid any situation they fear would make them feel helpless if a panic attack occurs. When people's lives become so restricted by the disorder, as happens in about 1/3 of all people with panic disorder, the condition is called agoraphobia. A tendency toward panic disorder and agoraphobia runs in families. Nevertheless, early treatment of panic disorder can often stop the progression to agoraphobia. Studies have shown that proper treatment, a type of psychotherapy called cognitive behavioral therapy, medications, or possibly a combination of two, helps 70 to 90% of the people with panic disorder. Significant improvements is usually seen within 6 to 8 weeks. Cognitive behavior approaches teach patients how to view the panic situations differently and demonstrate ways to reduce anxiety, using breathing exercises or techniques to refocus attention. For example, another technique used in cognitive behavioral therapy is called exposure therapy, can often help alleviate the phobias that may result from panic disorder. In exposure therapy, people are very slowly exposed to the fearful situation until they become desensitized to it. Some people find it the greatest relief from panic disorder symptoms when they take certain prescription medications. Such medications like cognitive behavior therapy can help to prevent panic attacks or reduce their frequency and severity. Two types of medications that have been shown to be safe and effective in the treatment of panic disorder are antidepressants and benzodiazepines. Excuse me. On that note, I don't sign up for that part, but I'm going to talk about phobias next in the next video. Love life, and life will love you back. Please like and share.